Hello everyone, I'm Dr. J, owner and director of the Functional Medicine Clinic, where ADHD is our primary concern. This is just a quick video that you requested on how we can help ADHD without medication, and if you're on medication, reduce the medication or get off it completely. ADHD, in my opinion, is one of the most misunderstood and mistreated diseases in the world. And it is even getting worse as ADHD medication shortages get to be more commonplace, with no sign of getting better anytime soon. As a parent of 16-year-old twins with ADHD who started on meds almost 10 years ago and have now been doing great without the medication, I'm here to tell you that you're in the right place to solve your ADHD. With over 20 years of experience treating ADHD in adults and kiddos with a very high success rate, we can and will help. Let me explain a little bit about how we can do that and the steps to see if your case is a case we can help. In the end, here is the real situation. We all want to help our kiddos succeed, and that's the end goal for both you and I. And if you're an adult, we want to take ADHD and make it your superpower to transform your life, and that is our goal. So take 5 minutes and listen to see what we can do with your help, and then at the end of the video, I'll tell you what to do for your next step. So how can we help with ADHD without meds? To start, we have to address ADHD at the cellular level, all the way out to the tissues and then to the organs. If we just address these symptoms of ADHD, we are setting you up for failure because we still don't know what is causing the symptoms to begin with. So let's just go over two of the most common tests we use to solve our ADHD puzzle. We have to look at nutrition all the way down to the cellular level to begin to solve your ADHD puzzle. A lot of times our patients have food sensitivities that are affecting the way their body handles their inflammation and their hormone responses. These aren't food sensitivities that are causing things that require like an EpiPen or anything, because it's not an anaphylactic shock or an allergic reaction or anything, but your body's not handling these foods well, and after a while, the body starts to fight back against itself, and it can wreak havoc in the brain and the nervous system, causing the system to be in overdrive or hyperdrive and unable to focus. There's a ton of research studies now showing that these food sensitivities can and are wreaking havoc on the nervous system. We've seen this and been solving this problem with our patients for over 20 years now. The next thing to look at is neurotransmitters in the body. So what the heck is a neurotransmitter? And why is it important with ADHD? Neurotransmitters are the substances that help carry the signal from the brain to the rest of your body. They are right in between the two nerve endings to help carry the signal. And if there aren't there in the proper amounts, then the nervous system operates in overdrive, trying to compensate for the lack of them. This can cause things like hyperactivity, overdrive, lack of focus, mood swings, having tantrums, and so many other symptoms. They are like the transformers that push the signals from nerve to make the nervous system work consistently. We have to make sure you have enough of them, or in some cases, not too many of them. We do this with a test that we can simply order for you. Here's the best part about these tests. These tests can be done in your own home. I can send them to a lab, but why would we take the chance, especially when some of the kiddos and some of the adults we already see are hypersensitive, and then we make that worse with a needle and then going to a strange place. And then you have the inconvenience of figuring out where to go and when to go. Our office simply orders them and they are sent to you at home, and then once the lab has the results done, we come up with a plan with you and give you your kiddo the map to solve your ADHD puzzle. Are there other tests that we can order for you? Absolutely. But a lot of times we don't need to order anymore. Food sensitivities and neurotransmitters are just two of the most common tests ordered in our office for our ADHD patients. We don't want to order tests that are not necessary. Every patient that comes into our office is given a thorough history, so we only have to order the tests that are necessary. And do patients need to take a bunch of supplements? Typically not. And if there is, it's usually a few, and it's usually only for a short period of time. We are firm believers in letting the nutrition of whole food change the behavior of ADHD with whole food nutrition, behavior modification, exercise, and other items we put into your plan to do most of the work. That's why we test, we don't guess. Medications have such a strong side effect, especially for kiddos and then adults too. But supplements can have side effects too as well, especially if they aren't needed. So why would we waste the time and money trying supplement after supplement, medication after medication that aren't needed And we know they won't work because we've tested the body first. So in other words, let's stop the guessing period. Let's test and find out what is missing or what the body has too much of and figure out what to do based on those objective tests. So what are the next steps? First, we do what we call an ADHD meet and greet. It's simply a 30-minute phone call that is of no charge to meet you and your kiddo if your kiddo is the one with ADHD. Why do we not charge for this call? Great. What's the catch? There is no catch. We used to charge $200 for this call. After a while of doing this, I just decided that it put too much pressure on everyone on that first visit, and we didn't really get to know the family or the person with the ADHD as well. So we decided to do them for no charge. It makes the calls so much more enjoyable, and when we both know there's no sales involved, it's even better. We typically have a waiting list for patients to get into our virtual clinic, so we absolutely hate sales calls, and we don't need to do them. So we hate them ourselves, and you will never get a sales call from us. This call is simply a chance for you to tell us what your specific situation is with ADHD or suspected ADHD and see if we can help. Even if we can't, I will guarantee that you will leave the call with some tips and tricks to help your ADHD. Helping others with ADHD feeds my soul, and it's what our office does, and we are one of the best in the world at what we do. So I promise you, you will leave with plenty of info for your 30 minutes of time. It's amazing to me that when I read all of the posts on our group and other groups with ADHD support, people are literally grasping and screaming for help. And then we don't hear from some of those people, and it just blows my mind. We will always make time for a call with you if you are serious about solving your ADHD. Our office has taken scheduled calls for people at 9 and 10 at night if that's the only time that works for everybody. We are here to help and give so much valuable information on our calls that even if you don't become a patient with us, I can never understand why anyone would not take 30 minutes to see if we can help their ADHD or what help is out there for their ADHD to make a decision. At the end of the video, I'll tell you how to check to see if we even have any available times left. Second, if we decide we can help, we will send you a history form and get you scheduled for a visit to go over that history in a little more detail. We typically do that later that same day or the next day. Usually we schedule that, like I said, in the same day or next day, so we get moving quickly in the direction to solving your HD. We don't wait that long like you have to wait for other stuff. If we haven't already decided on what tests we need to order, then we'll decide and get them ordered on the phone at that appointment. And in the meantime, we will email you strategies to help start to manage your ADHD while we wait for the test to get processed. Once the tests come back, then we develop a personalized roadmap with a timeline on what to do next with your personalized ADHD plan. Think of it as a personalized roadmap to solving your ADHD. There's no cookie cutter plan in our office. Each person is treated differently. This will also include parenting tips as well. We know that ADHD affects the entire family, whether it be the child or the adult with the ADHD, so we incorporate this as well in your plan. We call it Parent University, and it's included in every single ADHD plan we have. Then to finish off the plan, we make any changes that are necessary after going over it with you and developing the plan with you. And of course, we can make changes along the way as well. We schedule once a week check-ins that are included with calls, and you also have access to us via text and email along the way for any questions you might have. Our promise is that we will be with you every single step of the way. We've dealt with ADHD and we've seen it in thousands of patients, so we understand. So now take the next step, click on the link that's around this video or below this video to see if we have any available times for the initial meet and greet. Our electronic health record software is called Practice Better software, and it's completely HIPAA compliant for your privacy. So that's the schedule link you'll see. Click on the link and you'll be taken to the clinic schedule. Choose a time and choose a date that works for you, and that's it. The times fill up fast when we even have them available, so click on the link around the video and choose a time and date that works for you. And one of our doctors will call you at that time. We look forward to getting to know you and help solve your ADHD once and for all by finding the root cause of what is causing it. Thank you so much for your time. Have a great day, and we'll see you soon.